and then I'll do some introductions. All right, so I'd like to welcome everybody to the session tonight on study skills for test prep. And we have two really amazing speakers tonight, Dr. Mary Shotwell and Dr. Karen Snyder. Dr. Mary Shotwell has been an OT for 30+ years. She has practiced in psychiatric, physical disability, school system, and private practice pediatrics, as well as community-based practice. Over the past 20 years, she has worked with students in test taking, including weekly tutoring sessions, as well as a 2-day and seminar-long course to help students pass their national exams. In addition to Mary Shotwell attending tonight and speaking tonight, we have Dr. Karen Snyder, and she has been an OT for over 30 years and has practiced primarily in adult rehab, school system practice, and community practice. She has quite an extensive background and also a lot of experience with test prep. She has worked with students to prepare them for their national certification exams, as well as assist graduates who are not successful in passing their exams in a remediation process. So I'd like to welcome the two of you and offer you to share your screen, your presentation. And just so you all know as well that we've included some notes and resources in the chat via the Google Doc that you can reference.
Thank you, Elizabeth.
Thank you so much.
So I'm going to share my screen and do a little slideshow here. And there we go. Can you see what I see? The expert exchange thing? Do a thumbs up if you could see it.
Dr. Shotwell, can you click on from beginning? Because we see the note, all the sides on the left too.
How about that? From beginning?
Yeah, mine's not changing. Well, we can just go from here.
Wait, did it go?
Mine didn't change. I'm not sure about the rest of the attendees.
I can see the slide deck.
The whole thing, not just the notes, or yeah.
I can see the main slide and then the additional slides off to the left.
Okay, are we all right with that, guys?
Yes, you can hit
okay.
the presentation mode as well. On the bottom, the little icon, that should bring you there if you wish.
Where's
bottom toward the right of the screen, there's a little like screen with a base near the volume control on the bottom.
You have to double click on it.
That'll
double click on the screen, it'll bring you down there.
No, that just went to the next slide.
Oh.
I don't know why I never have problems with this. This is weird. Shoo, let me just stop for a minute and go back. Slideshow from beginning.
Yeah, that usually does it too.
It's not, but it's not letting me even do the slides. Weird. Okay. Let me just screen share again. I'll screen share. There we go. How about that?
Perfect.
Okay. All right. So our purpose tonight is to kind of talk to you. Obviously, we can talk all about testing in general and, you know, everyone's specific exam, but we're going to kind of talk to you about our experience a little bit in working with students and graduates. So obviously we want to attend a little bit to each of your exams, the physical therapy, occupational, and speech pathology. And these are some of our goals. So I'm going to take the beginning part and just talk about understanding each of your exams, sort of the anatomy of the exam, getting in the minds of the test takers and the item writers for the exam, thinking about how to develop a study plan for your exam, and how to assess yourself. Like, you know, you were in school for how many years? You can't take 3 years to review all the material you need. So, you know, how to kind of develop that. And Dr. Snyder will kind of get into more of the guts of dissecting questions and strategies to keep you motivated while you're studying. But if we could for a minute in the chat box, if somebody could read the chats, that's what I wanted to know, who you are and what discipline you are. And I'm wondering if you would tell us in the chat box, are you on leave of absence, or are you just a student who heard about this and you decided to come to the workshop?
So we posed the question already. They're DPT, OTD,
So,
MOT.
yeah, they're
And then
saying which terms they're in.
right. Yeah.
Yeah, so I'm kind of like wondering where you're at in your curriculum. Joe's an adjunct faculty, so we have some faculty here. Some people are finishing up the rotation. Some people are on LOA. Okay, so you're not all at the same point. That's good
Right.
for us to know. Okay, I have one more question for you to put in the chat box. Beside not passing the test that you're going to take at the end of this, what about the test evokes the most fear or anxiety, if anything? What evokes the most anxiety or angst about the test you're going to be taking? Time, the length, formatting of questions, time management, having to remember details, creating a study plan, what's feasible to do while finishing up my last rotation. Not necessarily the test, but studying for it. Great point. Length of time and wearing a mask during the test. Great point. A couple things that students have told me that you all took a GRE, so you probably know this, but is like the actual room you're in, the fact that you got to get fingerprinted if you leave to go get a break and come back in. It's like you might get hungry during the test. There's all these like weird things that could psych you out during a test, and we want you to be prepared for those or to anticipate this. I know this is a silly story, but I had a student who did not pass, straight A student, not here from this university, somewhere else. And she actually was on her menstrual cycle, and she had really bad cramps during the test, and she feels like that just tripped her up. So I know this is silly, but you might even want to think of something like that when you go to schedule the test. So anyway, we'll share some of those little examples that will help you. So, you know, what is the whole purpose of testing in general, right? The whole purpose is to assure that there is a minimum level of competency of people who graduate from an accredited professional degree program, right? So we want to know that if we are treated by a therapist in California, I'm going to get the same relative service as I do in Georgia, right? In general, right, we have to have these tests to meet state licensure requirements. And then I guess secondarily, these tests actually tell us in our programs, are we doing a good job? Are we meeting outcomes? So there's a whole host of reasons why we do these national exams. And I would say when Karen and I were in school, I think the test was easier. I don't think I was a good test taker at all during school. And I think these tests have gotten longer and harder. So I don't think any of you will probably be able to get away with not studying and just walking in and taking the test. So I'm telling you, kind of figure out a plan to study now for it. So what do we do at USAHS? It's a bit of a commercial to facilitate you passing these tests. So your faculty in all of your programs are constantly analyzing practice surveys. So when your testing body, Praxis, NBCOT, the PT exam group, make up the test. The way they make up the test is they survey generally first-year practitioners, and they ask them, what kinds of things are you seeing in practice as far as assessment or evaluation, intervention, what kinds of rules or laws or policies or supervision stuff, what kind of research are you encountering in your profession? So they are not asking generally 20-year practitioners what they're seeing, if that makes sense to you. The other thing that your faculty look at is these testing bodies also every few years, in addition to doing a practice survey, they will do a textbook survey, and they will ask, what textbooks are universities using? Because then we can make sure we're kind of consistent with other programs. And then the test writers look at that textbook survey and they will pull questions based on those resources that are used. So in each of our professions, PTOT speech, we have our Bibles, right? We have our big foundations textbook that most people, most programs are using in their programs, and they'll pull questions from there. What happens typically is they will actually convene a group of clinicians for an item writing workshop every few years. And they will have the textbooks available and they will write items. And, you know, your repertoire of questions on each of your exam changes, you know, it ebbs and flows, but it changes with practice. It changes with new items that they maybe have retired old items and add new items, those kinds of things. The other thing that we do as faculty and as program directors, we are constantly analyzing our exam scores. We're analyzing every test has certain domains, components or sub-components of your exam. And we look at which domains do our students tend to do better or worse on? And if we find that our students are slightly less than the national average, we're like, oh gosh, we gotta swoop in and beef up our content in our program. Obviously, we try to incorporate questions on our exams, and maybe like in one course in my program, one of the faculty members does Thursday trivia, and she'll pull questions from one of the exam prep books and post them on the discussion board and say, what do you guys think? Why do you think it was A or B or whatever? So that's another way we do it. We also obviously try to encourage you to do some kind of test prep toward the latter part of your curriculum. And most of our curricula have some type of review course or modules within a course that focus on test prep. The other thing of some of your faculty have even been item writers. So, you know, we kind of know what we're looking for in terms of some of these test questions. So what is the anatomy of each exam? And it's good to know about each other exam too. And the one I know the least about, sorry, but we do have a speech pathology faculty here, so he might be able to shed some light for us too, is the OT exam is around 4 hours long, 200 questions. It includes simulation and multiple choice. PT is a little bit longer, a few, 50 more questions, also includes simulation and multiple choice. And we'll talk in a minute what we mean by a simulation. The speech pathology, and this was my question, is it Joe is your name? Yeah, about the praxis. Do speech pathologists also take the praxis exam to be a teacher if they're going to work in the schools? He's shaking his head. Yeah. Yeah. Okay. So speech folks, you might have to take 2 exams, and we know how all of us love taking exams, so that's kind of interesting. In terms of the multiple choice components, most of our tests are scenario based. So they'll give you like a little 2 or 3 sentence vignette, and then you ask the multiple choice question, right? And most of us grew up with 4 choice multiple choice, and our test, and I believe the physical therapy test, is using 3 item multiple choice and some 4 item multiple choice. So to me, that would be a little weird when you get into the test and some of the questions have 3 answer choices and some have 4. So we just want you to be prepared for that. The simulations are interesting, and those are very hard for us to create exams and a computer program. Basically, it's pretty sophisticated computer program, but basically with the simulation, you're given a scenario and you're given like 8 statements. And it says something like, what should the therapist do first? Or what is the best course of action? And there might be 9 statements, and 3 of them might be wrong, not good answers. Maybe 6 to 4 of them are kind of neutral answers. They don't help you with the client. And then the other remaining answers are good answers. And the cool thing about these sims for us clinically is that they more readily simulate what's really happens in real life, which is you make a decision, you enact that decision, and then the client or the situation responds accordingly. And so on these, when you click on a box, you get a feedback box right away. So that could be good and bad, because if you chose a bad answer, it might say, well, you've just wasted 30 minutes reading the chart and you didn't learn anything new. And you're like, oh, that was a waste. But anyway, so you've got to practice with these simulations. In terms of the domains, each exam has its own domains. And the hard thing for us, guys, is that we are working with human beings, and your faculty and your fieldwork educators are saying, well, it depends, right? But on a test, there's got to be a right answer, right? When we're dealing with humans, there might be multiple right answers to solve a clinical dilemma, right? But on a test, unfortunately, we've got to find the right answer. And so what we find in our profession, you can see in OT, there are kind of 4 domains on our test, and where our students universally across the country tend to do the worst. And when I say worst, I don't mean they all fail. I just mean they do the weakest, if you will, on the intervention domain. And that's because when we work with clients, we have multiple options for treatment. So it's really important for those questions about intervention in particular that you go back and you read the stem of the question, because that should lead you more to the best right answer, right? And you can see some similarities, right, in our domains, right? We all three of our exams are looking at some type of foundational information. They all probably do something a little bit related to theory. They all do something related to assessment and evaluation. They all do something related to treatment or intervention planning. And they all, I'm not sure about the speech as much because they don't specifically say this, but I know for PT and OT, I call it the hodgepodge category. That's a Jeopardy term. And that is like, it isn't really intervention, but it influences intervention, like laws and ethics and management and supervision and reimbursement policy and those kinds of things. Okay. I do want to say about reimbursement, the national exam can only ask federal policy. It can't ask state policy, right? Because it's a national exam. Yeah, Joe, I have your domains there. I just didn't list them, but I have the same: foundations and professional practice, screening, planning, implementation. And so, yeah, so I think you kind of really need to know your domains on your test. And the real reason is when you read a question, I really want you to read that question and say to yourself, is this question asking me about screening and assessment, or is this question asking me about intervention? Because sometimes, you know, you got two answers that are good, but the question was asking about intervention, not about assessment, if that makes sense to you guys. Okay, so what about scheduling the exam? Okay, so how do I know when I'm ready? Well, some people, some students say, Dr. Shotwell, can you fill out this form before I graduate? And I know speech takes the test before you graduate, right? Is that correct? So that's actually a good thing. But for PT and OT, they're taking it kind of generally right after they graduate. But some students want to take it like the week after they graduate. And I don't, you know, if you're really disciplined and you're doing a good disciplined study plan before then, okay. But if you're not, and you need a couple weeks to decompress and not do anything, that's cool too. But what we do know is that waiting beyond 6 months to take the exam, and really even beyond 3 months, the pass rates start to go down because you get further and further from your didactic information, if that makes sense. Okay. The other thing and you know, so like how much have you studied? Some people, some students have said to me, which I'm like, oh my gosh, they're brave, is, well, I'm just going to use the first time as a, I'll see what happens. And I'm like, that's a pretty expensive, I'll see what happens, right? The tests are like $500-600. Like, I don't know. I think I'll spend a few 4 or 5 weeks studying so I don't have to spend that money. But I tell students, plan your loans, if you're using loans, or your budget, to save for an extra test. If you're doing Grad Plus loans, save a little extra money for an extra test. And then if you don't need it, you could go away for the weekend and celebrate. So just something to think about, because I have worked with students who don't have the money to retest. And then they have to go get a job, earn the money, and retest. And you don't want to get in that position. All of the tests have a waiting period between, if you don't pass, like some is 30 days, 45 days before you retest. For PT, I don't know about speech, you could put it in the chat box, but for PT, you can only take this test 3 times. For OT, you can actually take it multiple times. And then each state has rules about what you might have to do when you eventually pass. But we just know the longer you get away from school, you know, your pass rate. If you're waiting 6 months, that's probably too long. So I say within a month to 3 months after you graduate is a reasonable time. You also want to think about the time of day and when the site has availability of appointments. You don't want to take an appointment, you know, the only one is at 7 o'clock in the morning if you're not a morning person. So think about that. Think about the location of the testing center. Are you going to be completely stressed out because you're having a drive in downtown Miami and maybe you're not normally driving there and that stresses you out? That might not be a good thing. So think about that. Think about what's going on in your life. You're planning on having a baby, a wedding. I mean, I've had so many, not so many, but multiple students who were planning a wedding and their head wasn't in the studying. So maybe you need to either postpone the wedding or get married and then study. I don't know. So just think about that. The other thing is, when do they do the scoring? Our test, they only score twice a month. So you want to wait as little as possible. You want to take your test on Thursday and they score it on the following Monday or Tuesday. Then you're only waiting like less than a week for your results, something like that. So just think about that when you schedule it. Well, how do you know what content you should even study? Well, you can't review all your textbooks. Each profession has something called the practice analysis that is on your testing website that says, and it also says that a big portion of the test is covering this or that. So you need to look at the practice analysis, look at your own self-knowledge and your own self-experience. Like if you didn't do any fieldworks in pediatrics, there's going to be some content on this test on pediatrics. So you may have to buckle down more for the pediatrics test. And then what is your study plan gonna look like? 6 months, 6 weeks, 6 days before the plan? And I have a little example coming up. This is just something that I made up for my students, and it's like a 10-page document, and it lists almost every condition that we would cover in OT school. And I just make them check. I know a lot about the topic, I'm familiar but don't know much, or am I clueless? And for all the things they're clueless, they had better find a resource where they're going to read up a little bit on that, not in great detail, but so they at least know something about most of the diagnoses that are in your practice analysis. And then this is a sample study plan. Each study plan is going to be different for you in terms of content, but I would say each week, so this is like a 6-week study plan, and you notice I space out on here, when are we doing practice exams? When are we doing practice questions? Are we doing individual work or are we doing study groups? I would say you want to take 1 day a week off. And what a lot of people will do is they'll take Saturdays off. But what they'll do is they'll do one question on a social media website. And so each of our testing body has a Facebook, a Twitter, and an Instagram. If you have not signed up for those, go ahead and do that. There are some other Facebook groups. I'm just putting this out there because I don't want you to freak out. There are Facebook groups that are comprised of a lot of people who haven't been successful. And it might jade your perspective that, you know, when you see somebody on that Facebook group that says, I've taken the test 3 times and I haven't passed, but you're not hearing from all the people who have passed. So just keep that in mind when you're looking at those postings. And I would just go on the social media to look at some of the questions and see what you would answer. But try to give yourself 1 day off a week in general. And as you get clearly the night before the test, you don't want to be doing much at all. And, you know, I also want you to think about your physical and mental health, right? How many people, except in COVID land, sit for 4 hours or 5 hours at a time? Normally we don't. Normally we're getting up, moving around. And so you're not only having to sit, and you're having to concentrate and get the right answer. So you need to almost do physical conditioning for sitting for long periods of time. Now you can take a break during the exam, but you can't take too many breaks, and you'll take the break when the tutorial is running. That's typically because you won't be on the clock then. But so you really want to manage the physical need to sit still, healthy eating during, you know, obviously we all want to eat healthy, but before that, you know, I don't know about you, but at least when I was taking statistics over a 12-week, no, not even a 6-week summer session, I think I gained like 10 pounds because I was sitting at the computer eating and studying. And so you want to be careful about that, that you're, you know, eating very healthy, that you're doing something for your own mindfulness, that you are good at letting go, particularly during a test. You don't get psyched out with one question. I had a student who said, oh my gosh, I didn't study total knee replacements. And I'm like, and what was that question really about? It sounded like when she told me, you can't tell people what the questions are ethically, but when she started unpacking it, it was like, it was more of a question about a complex, like it's somebody who had a knee replacement plus a decubitus ulcer plus COPD. So the question really wasn't about a knee replacement, but the student got like so psyched out. And she said for the rest of the test, she kept obsessing that, oh my gosh, I didn't study knee replacements. And I'm like, really? Okay, there's a whole bunch of other stuff. So you have to learn to let go and know that some questions on the exam are trial questions. All right, so now I'm going to turn it over to my colleague, and she's going to talk about study skills, and I'll mute. And if you tell me when to advance.
Yeah, just
Okay.
a quick question before Dr. Snyder gets started. There was a question that came in from Ashley about, do you know what the social media test prep pages are called?
What I would do is go onto your testing agency's webpage, and at the bottom of their like description, they'll have a link to their Facebook, their Twitter, and their Instagram. And you click on those and you follow them on their pages. There's some other ones that say pass the OT. That doesn't belong to NBCOT, for example. So that's what I mean. There's other groups that are not affiliated with the testing agency, and to just take those with a bit of grain of salt. That's where I don't want you to get too obsessed with the social media ones because, you know, social media can be dangerous for your self-esteem.
Okay,
All
thank
right,
you.
thank you. You can go ahead and go to the next one. So I'm going to talk about study strategies, and we'll probably talk about, I want to leave a good 10 to 15 minutes for questions because I know you guys are going to have quite a bit. And everything that I'm talking about is also part of what Dr. McGee linked to the chat box. So you have all these pieces of information. But Dr. Shotwell talked about dissecting the question and identifying the keywords, and we're going to talk about that quite a bit. Generally, you have to have some knowledge about a lot of things, but to have specific knowledge, it's just impossible to study everything. So again, what is the question asking? And it may not even be attached. The answers may not even be part of the diagnosis that they're asking about. So you really want to be able to find what is the question asking. You're going to look for keywords, and you end up piecing the information together in your head. So it's not about knowledge. There are some knowledge-based questions on, you know, what do you do with the total hip replacement, right? But the majority of the questions really about what are you going to do realistically as a clinician? Choices, you know, we hear all the time that it comes down to two. You're able to knock out, if there are three answers, you can definitely knock out one of them. But you usually come down to those two questions, or two answers, sorry. But if you look back in the question and find the key word, you will have a correct answer. So that's what we were talking about, those true or false statements, if you understand what that question is asking. Look for those. What do you do first? What is the best answer? What do you do next? They usually have them bolded, which is nice, but you'd be surprised at how easy it is to go into, you know, instead of what would I do next, what should I do right now? So really pay attention to the question. Go ahead. Clinical sim. And Joe, are there clinical sim questions in the praxis test?
I'm going to say that I'm not sure. I believe that we are moving to that type of a format.
Okay.
Again, they went on those three categories. That's kind of why I'm looking at.
Okay, perfect.
More.
Yeah, thank you. The reason why we bring up clinical sim testing, I find I work mostly with graduates who have not been successful. And I find that it's the clinical sim that trips them up. And the reason why is because they're not following the kind of that standards of practice. You evaluate, you assess first, then you go into a treatment plan, then you go into intervention, and then discharge. And so the scenario is a basic scenario, but then they'll move to 4 different sections of the clinical simulation. And while graduates don't realize this, and so when they provide you with these answers, but they're asking for assessment, but they're giving some great treatment question or treatment answers, graduates are picking those answers, but they're not asking for treatment. They're asking for assessment. So you must read the question and follow through accordingly. And that's true for every single question. So again, Dr. Shotwell talked about if you click on one and you know that is right, and go ahead and click on it, it's going to give you some feedback. And so by following that feedback, it may help you through the rest. There may be some that you absolutely know that are not correct. You know, you can knock them out. It's the iffy ones that you are really doing a lot of clinical reasoning, and those are the ones you want to spend time on to think about, you know, is it appropriate in this particular time within that patient's time with you for assessment, or are we in treatment planning, things like that, okay? The neutral statements, and if you go into your practice books, they may give you some clinical sim opportunities. They may not give you neutral questions, but on the exam, there may be neutral questions. They're actually worth 0 if you do click on them. The correct ones will be a +1, then the incorrect choices will be a -1. Generally, each test is a little bit different, but just know that it gives you that opportunity to really think about what you should be doing with that client at what particular time, okay? And Dr. Shotwell had given us an opening scene, and so you always in the beginning, what are you going to gather from the medical record? What are you going to gather from the client themselves? And what are you going to gather from others who can provide information? Okay, next. So these key words, and this is directly connected to that handout that's in the chat box. Find the key words. Keywords could be theories, models of practice, things that you learned in your foundational course. So I'm going to give an example. If they're asking about the biomechanical approach, you're looking for terminology that corresponds with the biomechanical approach. If they're asking for a neurological approach, you're looking for those key words. So the approach is the key word. So you're looking for answers that include those neurological approaches. And that's going to be across all 3 disciplines. So really take a look and know your frames of references. OT has a lot of models of practice, frames of references, and there are keywords attached with each one of those. Practice settings. Another keyword to look at. If they are in an acute care setting, you know that you're not going to be focused on driving, or focused on uneven surfaces, or focused on advanced cognitive skills, right? We are working on those basic skills to get that client to move to the next practice setting. Scope of practice, this is thrown in. When do you refer to another discipline? So it's, you know, we have to make sure we know our own scope and stay within the scope, because unless that clinician is not experienced in that area. So I brought up in the example, driving. So if we have somebody coming into outpatient and they want to work on driving skills, and that clinician is not experienced in that, we are going to refer out to another discipline, okay? So think about that. It should be fairly cut and dry when it comes to scope of practice, but you really should be very well aware. Dr. Shotwell already talked about this. Are they asking about evaluation, or are they asking about treatment ideas? Make sure you know what the question is asking for, because they will mix it up. They will put assessments and treatment, and they're all correct, but they're just, it depends on what the question is asking. Diagnoses, if it is a degenerative situation, degenerative disease, then you are looking for a more compensatory approach, looking at you know, chin tucks or proper positioning or pacing. So know what the diagnosis is. If it's something like total hip replacement, then we know that the client is going to get back to a normal situation after they followed their precautions for a certain amount of time. Spinal cord injury, CVA, I mean, we know that there's going to be some rehabilitative approach to that. So be very cognizant of cognitive issues such as traumatic brain injury, where we do see improvement, and cognitive issues where we continually see decline, such as Alzheimer's. Okay.
One other thing too, Karen, is like lots of times they may give you a stage of a disease.
Yeah, that's
and
true.
Parkinson's, a Han and Yahr stage, whatever, and you're like, oh crap, I didn't study these stages. So anything that's a stage of a condition, I tell people, remember the anchors, remember the beginning and the end of the stage, and then maybe if you can remember the middle, like Rancho Los Amigos, I know 1, 4, 10. Right? And then I don't have to remember the rest of the middle descriptions. My brain can fill in the blanks. So if you know the stages of a condition, particularly these progressive conditions, like early stage Alzheimer's, you can still do some stuff, right? But like stage 4 through 7, it's definitely going to be more caregiver stuff and way more environmental than remedial for the client, if that makes sense.
Yeah, thank you. Also going into differential diagnoses, we all, and that's exactly what Dr. Shotwell was speaking about, was looking at where they are in what stage of their disease, or what acuity, and what is the best plan of action. What assessment should you be using? I'm sorry, we have a new dog here. So, okay, next. Other considerations, again, what is the question asking? Chain of command, what do you do next? What do you, who should you contact at what time? If it's an emergency situation, you're not going to go to your supervisor and say, what do I do? You're going to contact the physician. If you hear a pop and the patient all of a sudden is in increased pain, you're not going to go to your supervisor and gain, advice. You're going to contact the physician right away, tell the patient, no exercise, things like that. So know when to go where. If it is an ethical consideration, they're always, well, when do I go to my supervisor if I, see something happening? If you see something happening and you don't quite know the big picture, that's when you go to supervisor. When you know a colleague is doing something unethical and everybody's turned a blind eye, then you would go to more extreme. Answer questions that are client-centered across the board. It should use client-centered terminology, the answers. Some of them are very short. Sometimes the more client-centered ones are a little bit longer. Safety and positioning across the board. We want to make sure our clients are positioned correctly before you do something such as swallowing, such as meals. We want to make sure we're addressing pacing, things like that, to increase the safety of our clients. And think developmentally. So, and that's with adults as well as children. Think what typically comes back first, which are the larger muscle groups, and then the finer, the small movement. Okay, pharmacological side effects. Those pharmacological agents can do a number on our clients. That's why it is so important to make sure that we are addressing, we are looking at the chart prior to meeting with our clients to see if we can easily stand them, and what are the side effects of the medications they're taking Do we need to wait a minute before we actually move the client forward? Lab values and vital signs, the same thing. We should be taking blood pressure. We have to watch for orthostatic hypotension, things like that. So those are the things you really need to take care of beforehand. In the handout, I talk about all of these as well. But one of the other things that I talk about is, what is the question asking? And sometimes if you read the question, if you're reading the last sentence of a long question, most times it's directing you to exactly what the question is asking. And sometimes it's the last two sentences. So I always say, if you have a long sentence, read the last. If you have a long paragraph, read the last sentence at first and then go back up and read. Another thing you can do sometimes, if you just have no idea, you can read the answers first, get a good idea, and then go back to read the question. Practice those things while you are studying for the exam. Don't wait for the exam to do that. See what works best for you. Okay, next. I'm kind of rushing through a little bit. Oh, here's your exam prep resources. There are YouTube exam prep suggestions. There are go to your national exam site. There are the prep books, the apps, question of the day or question of the week. If you go back to Dr. Shotwell's, prep, day by day, it has a lot of these. Take the prep, and so before you go and take that exam, you have to make sure you take a practice exam for the same amount of time, because it is a test of endurance and it is a test of concentration. And I'm going to talk about how to keep that concentration next.
Can I just add one thing about the social media?
Yeah.
Only because it happened about a year ago in the OT profession that some students posted a copy, I think, of the exact question from maybe the NBCOT study materials or from the therapy ed book, and they posted it onto a social media group. And they didn't cite it. They didn't cite where it came from. And probably you shouldn't put that on social media anyway, because when you do that, then people won't think they have to buy those resources, right? So you're hindering their trade. And what NBCOT did, they prohibited those students from taking the national exam for 6 months. That was their punishment for posting questions on social media. So fine to look at like the associations who they post questions, but don't post your own, at least verbatim, because you don't want to get in trouble for copyright infringement. Just saying.
Yeah, good. I remember when that happened. The big thing is go with your gut when you're taking that exam, when you're really trying to decide between the two final answers. Go with your gut. You can always flag the question and to come back to it, but don't change your answer unless you absolutely know that answer is incorrect, because typically the gut
Dr. Kiernan, we teach neuroscience together, and she says your limbic system usually knows the answer. That's your like subconscious mind, right? It knows the answer. And usually what happens is our frontal lobe, we talk ourselves out of the right answer.
That's right.
So just think with your limbic system.
I love it. That's that gut response. Okay, next. All right, these are the ones that, it's a very long exam and most people have difficulty concentrating for this long. So what you need to do and practice now is use focus strategies. We teach deep breathing, proprioceptive exercises, anything to get your brain to focus. So typically what I say, every 20 to 30 minutes, you need to step away, close your eyes, and do some type of deep breathing. Some people sing a song, some people do a little mantra, but I teach people how to get some proprioceptive input into their bodies and pushing down on the top of their head, doing chair push-ups, and trying to get some proprioceptive input to get your brain to refocus. So that is one strategy. It paces your brain to manage shorter chunks of time. Instead of 4 or 5 or 2.5 hours straight, your brain cannot manage that time. So you really want to chunk it. So going back, take a bathroom break at least one time during the exam and bring a snack for that break. So the test centers allow lockers and you can just go in, take a quick bite, and then get re-fingerprinted. If you go through the entire exam, you're going to see the decline in performance as time goes on. If you use these test-taking strategies, you'll see more of an equal focus and performance from beginning to end. So it's very important that you feel comfortable taking a break and getting up and going to the bathroom. The movement alone normalizes the activity in the brain to increase that focus. Okay, next. Just check to see if your exam site offers, and I'm not sure if this is true for every discipline. I'm assuming it would be because we all go to the same test sites. So they offer a dry erase board. Write everything down in the beginning. Dump it out of your brain and onto that dry erase board. That will help you organize yourself. Things like Rancho's levels, spinal cord injury, developmental levels, things that are just, you're just trying to keep it in and doing your best you can to remember it during the thing. So if you can use that dry erase board, it's very helpful. On the exam itself, you can cross out answers that you know are wrong. It gives you that visual representation. Here's my 2, answers, and then go back to the question and say, what is the keyword that directs me to that correct answer? Don't leave questions unanswered. Don't come back to answer. Go with your gut, flag it, and then come back. And do not change that answer unless you absolutely know it's wrong. And if you run out of time at the end, do not Christmas tree, because you have more of a chance of getting, if you choose B all the rest of the way down, you have a better chance of getting some of those answers correct. Okay, next. And I think that's it. We put our contact information, so you can contact either Dr. Shotwell or I. And so we would love to have your questions. I know it's 8 o'clock, but anybody who wants to stay on will definitely answer any questions that you have.
Okay, well, thank you both. I did just add again the link to the presentation materials in the chat, so you can copy that link and save it for later access. But any questions for either Dr. Snyder or Dr. Shotwell before we wrap up tonight?
And even if you can add in the chat, was this helpful to you to prepare to take the exam? I think that would be really useful for us.
Yeah, and then anything that you'd like to learn more about, or areas that that you feel like could be expanded upon. So yes, very helpful strategies. Very helpful.
Okay, good.
Well, it
Good.
looks like a lot of positive feedback. So thank you both for attending tonight, and you provided your contact information on the last slide, so everybody should have it.
Yeah.
And we did record this session, so if you want to loop back and watch it, we will be posting it to the Keep Learning site.
There was, Lindsay asked about the dry erase board. I thought I heard they don't do that anymore. I had not heard that.
As far as I know, they still do. So I'm
yeah,
not
maybe
sure.
not during
Yeah.
COVID, and I don't know how
Right.
they're doing that. I know the testing
Well,
is difficult during COVID, so
yeah.
it
Yeah.
could be. How many full practice exams do you recommend that we take? I usually say one, because you kind of saving that one full practice exam and taking that before, just for timing and pacing.
I would do as many like 2-hour exams as you can purchase. So, you know, you can like therapy ed, I think, I don't know if speech has therapy ed, but PT and OT do. And there's, in most of your books, most of your review books are going to come with 4 practice exams that are like 100 questions. So they're, oh, well, speech has it too. So they're going to have 4 exams, and then you could buy other exam books. So that would give you, if you bought 2 books, you have 8 exams there, and they're like 100 questions, right? And then buy one of the full-fledged practice exams from the actual testing agency. And that's the one that I would wait until I'm a little closer, you know, maybe 3 weeks to 4 weeks into my study plan, to make sure, okay, I have the endurance to sit for the longer exam. So then in a 6-week study period, I might have done 8 practice exams, and only one of them is a lot longer, right?
Ashley asked about rules for taking the exam for OTD students. I've heard we can take it right after fieldwork before finishing the OTD portion.
Yes, and you can. You have to wait till you finish all the didactic portion. So if you, like for our program, you can take it at really the tail end of your 7th term. Most students that do take it before they graduate are taking it in their 8th term. But it really depends on what's going on in your capstone and how involved your capstone is going to be in terms of travel and all that other jazz. So
just to let you guys know, NBCOT changed that. We are no longer allowed to do that, unfortunately.
For the OTD students?
Yeah, a few of us are in our 8th term, and we're literally preparing to take it, and they changed the policy like a couple months ago.
Well, thank you for letting us know.
Yeah,
I thought, Lindsay, that was the ACVF policy.
We had asked, unless our program director gave us the wrong information, but we had asked her specifically, and she said she had said we can't anymore. So, I mean, maybe I can reach out to you guys and ask if you can give us more information, because we didn't fully understand, but we had checked with our program director for that reason, and she had said that we are not able to anymore.
I bet you Dr. Shotwell will find out.
Yeah, I will.
Great.
I will.
Thank you.
All right,
I'll
thank
shoot
you.
you an email.
Okay.
That'd be
Sounds
great.
good. Yeah.
Great questions.
Yeah. Okay.
Yeah.
All right.
All right. Well, thank you, everybody.
Okay.
And thank you, Dr. Shotwell, Dr. Snyder, for your time. And then, you know, if there are additional questions, certainly reach out. I know the 2 of them are always open to questions and willing to kind of follow up as needed. So thanks, everyone, for a great discussion, and have a wonderful evening.
Thank
Okay.
you.
All right.
Bye-bye.
Bye-bye.
Good luck to you.